Welcome to LPN LaunchPad's review for medication administration assessment. Do you have questions related to anything related to nursing? Ask them in the comments, and I will do my best to provide helpful answers. Medication assessment is essential because it ensures patient safety by identifying contraindications or potential interactions, reducing the likelihood of errors and adverse effects, and ultimately improving patient outcomes. This review aims to explore subjective and objective data gathering, understand the medication reconciliation process, and emphasize the importance of documenting drug allergies while checking for contraindications. Subjective data include patient reported symptoms such as pain or nausea, a thorough medication history, including past adverse reactions, side effects, and compliance, and lifestyle factors like diet, smoking, or alcohol use, all of which may impact adherence and drug metabolism. Objective data in this context often center on vital signs, blood pressure, pulse, temperature, and respiratory rate, especially crucial for cardiovascular or respiratory medications. Lab results like blood glucose, liver function tests, and kidney function, BUN/creatinine, help detect any issues affecting medication dosing or clearance. Additional objective data from physical exams might involve assessing skin integrity, relevant for topical and transdermal meds, edema, considerations for fluid balance or diuretics, and other signs pointing to altered absorption or excretion patterns. Medication reconciliation is a systematic review of all current prescriptions, over the counter drugs, herbs, and vitamins designed to prevent oversights, duplications, or drug interactions. It should be performed upon admission, transfer, or discharge. Medication reconciliation includes collecting and verifying all medication sources, assessing for duplicates or negative interactions, and then reconciling and communicating the updated medication list to all relevant healthcare personnel. Abnormal findings during assessment can encompass polypharmacy, which increases the potential for interactions, particularly in older adults, and non adherence due to cost or side effects. An NCLEX tip always verifies how patients take their meds instead of how they are prescribed. The patient may require further education on taking the medications, or the physician may need to be called to adjust the prescription to match the patient's practice. Documenting drug allergies is vital for preventing adverse reactions. Note any past reactions, like rash or anaphylaxis, and remember potential cross sensitivity, such as patients allergic to penicillin who may also react to cephalosporins. Contraindications represent factors making medication use risky or unsafe, which can include pregnancy, renal or liver dysfunction, or cardiovascular conditions that certain drugs may exacerbate. High risk populations include pregnant or lactating patients, where medications may cross the placenta or appear in breast milk, older adults prone to polypharmacy and reduced metabolism or excretion, and those with chronic conditions like diabetes that affect how drugs are processed. An NCLEX study tip for medication administration is always to assess the patient's history, allergies, and contraindications before giving medications. Ensure accurate reconciliation to avoid duplications and adverse reactions, and apply the SAFE principle: side effects, allergies, food interactions, evaluation of effectiveness. Extra caution is imperative for high risk meds such as anticoagulants, opioids, and insulin. NCLEX practice. Question 1. A nurse reviews a patient's medication profile, noting the patient takes an ACE inhibitor for hypertension and ibuprofen, and NSAID for joint pain. Which assessment finding is most relevant to potential renal complications? A. Elevated liver enzymes. B. Elevated BUN and creatinine. C. Low blood glucose levels. D. Reduced WBC count. The correct answer is B. Elevated BUN and creatinine. Both ACE inhibitors and NSAIDs can reduce kidney function, so monitoring renal labs is crucial when these are combined. NCLEX practice. Question 2. A patient with a known penicillin allergy is prescribed a cephalosporin antibiotic. Which is the best nursing action? A. Administer the medication and monitor for 1 hour. B. Call the prescriber to verify the order. C. Provide only half the ordered dose initially. D. Ask the patient to sign a waiver for potential allergic reaction. The correct answer is B. Call the prescriber to verify the order. Individuals allergic to penicillin can experience cross reactivity with cephalosporins, necessitating verification before administering the new antibiotic. NCLEX practice. Question 3. Medication calculation. The provider prescribes cefazolin 500 milligrams IV every 8 hours. The vial on hand contains 1 gram of cefazolin and is reconstituted with 2.5 milliliters sterile water to yield 400 milligrams per milliliter. How many milliliters will the nurse administer to deliver 500 milligrams? A. 0.75 milliliters. B. 1.25 milliliters. C. 1.5 milliliters. D. 2.0 milliliters. The correct answer is B. 1.25 milliliters. The calculation is 500 milligrams divided by 400 milligrams per milliliter, resulting in 1.25 milliliters for the appropriate dose. Final key takeaways include thoroughly assessing subjective and objective data before medication administration, reconciling all medications to prevent duplication, checking for allergies and contraindications, and meticulously documenting to promote continuity of care. Questions? If you have questions related to nursing school material or issues needing clarification, leave them in the comments, and I will do my best to provide thorough answers. Hey there, this is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free using YouTube videos that can be watched or listened to without losing value. It may be free, but it is still valuable. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe buttons and continuing to watch my videos. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description or search for LPN LaunchPad in the Explore GPT box. This review has been an LPN LaunchPad production. We care for our future nurses by freely sharing knowledge.